Every day, people die outside of the hospital of sudden cardiac arrest. There is something you can do to help. It's called compression-only CPR. Today we'll teach you about this life-saving skill. We'll show you how you can practice at home with just a few household items. Let's go to the doctor to hear a little bit more about why CPR is so important.
Every year, more than 100,000 people die of sudden cardiac arrest. This can occur when a medical problem, such as a heart attack, causes a patient's heart to not beat normally. When the heart is not beating normally, blood is not being pumped to the person's brain, and the brain quickly starts to die. This is where you can help. By performing compression-only CPR, you can help the heart pump blood to the person's brain, and this might save their life. So if you see someone collapse, check and see if they're okay. Call 911 and ask someone to get an AED. An AED can reset a person's abnormal heartbeat. While you're waiting for more help or an AED to arrive, continue performing compression-only CPR. Don't be afraid to try it. You can only help.
I don't feel well. If you see an adult suddenly collapse, it is very important that you stay calm and act fast. You should check to see if the person is okay by shaking them and shouting.
Professor, are you okay?
If the person doesn't respond or doesn't wake up, call 911 or tell someone else to call 911 right away.
He's not waking up.
Stay calm and call 911.
It's better to have more than one call to 911 than none at all.
911? My professor collapsed. We need an ambulance.
If the person is not breathing normally and doesn't wake up, you should start compression-only CPR. Even if the person takes a single gasp of air, like this, but is not breathing normally, you should still start CPR. Kneeling at the victim's side, place the heel of your hand in the center of the victim's chest, between the nipples, in the middle of the breastbone, with one hand on top of the other. Lock your elbows, move yourself over the person, bend at your waist, and use your body weight to push straight down at least 2 inches. It is important that you let your hands come all the way up off the chest to let the chest return to normal before pushing down again. Push hard and fast at least 100 times per minute. If you quickly count 1 and 2 and 3 and 4, you'll be doing compressions at about 100 times per minute. Continue this until more help arrives. Don't stop even if you feel a cracking or popping sensation in the victim's chest. This can sometimes happen. Keep going until more help arrives, the person wakes up, or you're so tired that you physically can't continue. Now we'll teach you how to make your own CPR training tool so you can practice along with the video. You only need 3 things: an unused roll of toilet paper, a t-shirt, and a nice thick towel. Go get these items and feel free to pause the video while you get them. So we'll start by taking our toilet paper tube and our t-shirt. We suggest a thick t-shirt, possibly an extra large or extra large. We'll stuff our t-shirt through the center of the toilet paper tube. We're using a fluffy 2-ply toilet paper, which gives you a little bit more resistance. It's a little more realistic. So place your tube and your t-shirt in the center of the folded towel and fold your towel over the top. This gives you a chest to practice on. So like a real person's chest, you'll need to compress our chest at least 2 inches. That's about the width of a credit card. So go ahead and try it along with us. So place your hand in the center of the victim's chest, your other hand on top, interlock your fingers, and move over the top of the victim. Push down, and you'll feel the resistance against the toilet paper tube and its recoil against your hands. And go ahead and practice along with us. Now we'll review all the steps of compression-only CPR. Practice along with the video. If you see someone suddenly collapse, it's very important that you stay calm and act fast. First, check to see if the person is okay. Shake the victim and shout to try to wake them.
Professor.
If the victim doesn't respond to you, call 911 right away, or make sure someone else is calling 911 and ask for an AED.
You, call 911, get an AED.
Place the heels of your hand on the center of the victim's chest, between the nipples, in the middle of the breastbone, with one hand on top of the other. Lock your elbows, move yourself over the victim, and push straight down at least 2 inches. Push hard and fast at least 100 times per minute, and make sure to let your hands come all the way up off the chest so the chest can return to normal. Let's continue this for another 30 seconds or so. Practice along with the video. That's all you have to do if you see someone suddenly collapse. Call 911 and push hard and fast on the center of the chest. Feel free to review this video as many times as you'd like. This is a very important skill to learn for yourself, your friends, and your family. We encourage you to learn more about CPR and suggest that you take a formal CPR class. For more information, please visit the American Heart Association or American Red Cross websites.